The Octa Research Group sees a prolonged COVID-19 surge as the country detects new subvariants. Philippine College of Physicians former president Dr. Maricar Limpin is joining us via Zoom this afternoon to give us her insights on this. Dr. Limpin, good afternoon. Welcome.
Good afternoon, Rika, and good afternoon to everyone.
Doc, thank you for joining us. First, let's talk about these subvariants. Now, we reported that the BA.5 is dominant in most regions here. What do we know more about this variant, Doc? And can you describe to us how people are getting sick of COVID nowadays?
Well, it seems like the new variant, the BA.5, no, I think it's the more predominant variant now that we have in the country. It is highly transmissible, and that is why we see a lot of people getting infected, no. But maybe, as to whether it can cause severe COVID-19, I think it will still depend upon the individual that is being infected, no. So if the individual is an elderly or has a lot of comorbidities, and then with with insufficient vaccination, then most likely they will have severe COVID-19, and that is why very important is still to protect the individuals, the Filipino people. We still push for vaccination, particularly the booster shots.
Doc, is that why hospital groups are saying that the COVID admissions remain to be low? And do we know if, or do we have data if recovery at home is taking longer than usual? Because back in January, when there was a surge, it took more or less about a week, and people felt it was just like a regular flu, and after like so-called a week or 10 days or so, people were back to being recovered.
Actually, the illness itself, no, with this variant that we are seeing is maybe similar to the surge or the cases that we have seen last January. It's not as short as the one we've seen in January, but it can last to about 7 or 10 days, no? And unlike in the first few cases, no, the first year of COVID-19, wherein the infection can last as long as like 2 weeks to 4 weeks, no. But here now we have seen cases or illnesses lasting from about 7 to 10 days, and the most common symptoms that has been presented, no, by many of the individuals infected with COVID-19 right now is really sore throat with some changes in the voice, no, there's hoarseness and a lot of colds, no. So these are some of the symptoms. And then there is also the body aches or body pains, no, that one experiences, just like similar with any other viral infections.
Doc, the Omicron Centaurus subvariant is already here in the country. Now, what do we know about this so far?
Well, basically that is the BA.2.75. There is just one Twitter user who actually called it Centaurus, no, so that's why it was called Centaurus. But that is not the official name of this particular variant, no. So we're still awaiting the official name from the WHO, no, or from whoever is going to really give the official name. But what we have seen, it is very similar, no, a few mutations, but very similar to the original COVID-19 strain. So but except that the symptomatology of the patient is not as long as the original COVID-19.
Doc, let's talk about monkeypox. How likely is local transmission to happen? And can this possibly overwhelm or pose a challenge to our healthcare system with COVID still being around?
Well, we have seen how it is already being, how how US is now seeing a lot of cases of monkeypox, no? So since we have already detected the first case of monkeypox, then we can actually expect local transmission to occur. And since one of the mode of transmission is that it can be sexually transmitted, therefore, particularly among the male, the male sex who's having sex with another male, then there is this possibility that there can be local transmissions, and therefore it is really very important right now. Our main concern is to ensure that the doctors, the healthcare personnel know what to do if and when they encounter such cases. So we should be able to handle that, and we know what to do. To whom to refer the patient, in case we need to have them diagnosed, and then eventually, have them handled or managed appropriately.
Well, thank you, Doc, for sharing with us your time and your insights. That's PCP former President, Dr. Maricar Limpin.